Were you hinting for a moment we could prevent prostate cancer? Because if you did, I mean, people would love to know if there's a way to do that.
So, as you know, a lot of these cancers can be to some extent linked to lifestyle choices, right? Prostate cancer is a disease of aging. So, you well know that as we age, if we autopsied maybe every 80-year-old or every 90-year-old man, we're going to see a large percentage of them have prostate cancer. It's not really an avoidable disease in that sense, but how we look at diseases of aging and what we can do to extend the time before we start to age in that way is really critical. Does that make sense?
Yeah, and I think that a lot of people don't understand that they've done autopsy studies and they found that almost 40% of men at autopsy globally will have prostate cancer. However, clinical disease that actually expresses itself and spreads within the human body and causes the maladies that men suffer from, doesn't occur in the same amount, and even more importantly, doesn't occur in the same amount globally. And we'll see higher incidence of clinical prostate cancer, disease that actually expresses itself in such as in areas of Africa or the Caribbean, also in some parts of Europe and in parts of the U.S., and lower incidence perhaps in the Far East. We don't know how much of it could be dietary or stress related or other lifestyle factors.
Right. But we do know that some choices, like eating a diet lower in saturated fat, working on obesity, getting metabolic markers under control, meaning what your cholesterol picture looks like, what your sugar picture looks like, that those things can be very helpful in preventing the way that prostate cancer expresses itself, if it expresses itself.
And I think that's always a great thing to talk about.